Question 1. Comparative studies suggest that medical assistants with phlebotomy responsibilities are often at the forefront of handling sensitive patient data. A medical assistant is tasked with preparing a patient's chart for an upcoming appointment. The patient has a history of a sensitive medical condition that is not directly relevant to the current visit, but is documented in their electronic health record. The medical assistant needs to access this information to ensure all necessary forms are prepared. Which of the following actions best upholds patient privacy and data security? Option A. Reviewing only the sections of the electronic health record directly pertaining to the reason for the current visit and ensuring the workstation is logged out when leaving it unattended. Option B. Verbally discussing the patient's sensitive medical condition with a colleague in the hallway to confirm the correct forms are being gathered. Option C. Printing the entire patient chart, including all historical data, and leaving it on a desk for review by the physician later that day. Option D. Accessing the patient's full electronic health record, including the sensitive condition, to ensure all potential needs are met for the appointment. Correct answer is D. Accessing the patient's full electronic health record, including the sensitive condition, to ensure all potential needs are met for the appointment. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare settings where a medical assistant with phlebotomy duties handles sensitive patient information. The professional challenge lies in balancing the need for efficient data access for patient care with the stringent legal and ethical obligations to protect patient privacy and data security. Mismanagement of this data can lead to significant breaches, impacting patient trust, incurring legal penalties, and potentially harming patients. Correct approach analysis. The correct approach prioritizes patient confidentiality and data security in compliance with relevant regulations. This involves understanding and adhering to the Health Insurance Portability and Accountability Act, HIPAA, in the United States, which sets national standards for protecting sensitive patient health information from being disclosed without the patient's consent or knowledge. Proper data management includes secure storage, controlled access, and appropriate disposal of patient records, all of which are mandated by HIPAA. Implementing these practices ensures that patient data is protected against unauthorized access, use, or disclosure, representing best professional practice. Incorrect approach is analysis. An approach that involves sharing patient information verbally with colleagues without verifying their authorization or need-to-know basis is a direct violation of HIPAA. This practice bypasses established security protocols and creates an unacceptable risk of unauthorized disclosure. Another incorrect approach is leaving patient charts or electronic health records, EHR, accessible on unattended workstations. This exposes sensitive data to potential viewing by unauthorized individuals, which is a breach of HIPAA security rule regarding physical and electronic safeguards. Finally, disposing of patient information by simply placing it in a regular trash bin without proper shredding or destruction is a failure to comply with HIPAA requirements for safeguarding protected health information. 5. During disposal. This practice makes the information easily retrievable and vulnerable to misuse. Professional reasoning. Professionals in this role must adopt a proactive and diligent approach to data management. This involves understanding the specific data security policies of their employing institution, which are designed to align with federal regulations like HIPAA. When faced with a situation involving patient data, the decision-making process should always begin with a question. Is this action necessary for direct patient care, and am I authorized to access or share this information? If the answer is unclear, seeking guidance from a supervisor or designated privacy officer is paramount. Regular training on data security and privacy best practices is essential to maintain awareness and competence. Question 2. Cost-benefit analysis shows that thorough patient preparation and assessment prior to phlebotomy procedures significantly reduces the risk of complications and ensures specimen integrity, yet some practitioners may be tempted to expedite this step. Considering the regulatory framework for a certificate in medical assisting with phlebotomy, which of the following actions best exemplifies a risk assessment approach to patient preparation and assessment before a routine venipuncture? Option A. Performing the venipuncture immediately upon the patient's arrival to minimize wait times, assuming all necessary preparations have been completed by other staff. Option B. Relying solely on the patient's verbal confirmation that they are feeling well and have no known issues, and proceeding with the venipuncture. Option C. Reviewing the patient's electronic health record for relevant medical history, inquiring about fasting requirements if applicable to the ordered tests, asking about current medications that might affect bleeding, and assessing the patient's general well-being and any specific concerns they may have about the procedure. Option D. Confirming the patient's identity and the ordered tests, briefly asking if they have any immediate discomfort, and proceeding with the venipuncture. The correct answer is D. Confirming the patient's identity and the ordered tests, briefly asking if they have any immediate discomfort, and proceeding with the venipuncture. Explanation. This scenario is professionally challenging because it requires a medical assistant to balance the immediate need for a phlebotomy procedure with the patient's potential underlying health conditions that could impact the procedure's safety and accuracy. A thorough patient preparation and assessment are paramount to avoid complications and ensure reliable results, directly impacting patient care and adherence to regulatory standards for medical assistance. The correct approach represents best professional practice because it prioritizes patient safety and the integrity of the diagnostic process. By conducting a comprehensive pre-procedure assessment, including reviewing the patient's medical history, current medications, and any known allergies or contraindications, the medical assistant adheres to the fundamental principles of patient care and the scope of practice for a certified medical assistant. This proactive assessment aligns with guidelines that mandate ensuring patient readiness and identifying potential risks before any invasive procedure, thereby preventing adverse events and ensuring the validity of the collected specimen. This aligns with the ethical obligation to do no harm and the regulatory requirement to perform procedures competently and safely. An incorrect approach that bypasses or inadequately performs the patient preparation and assessment phase is professionally unacceptable due to specific regulatory and ethical failures. Failing to inquire about fasting status when required for certain tests, for example, directly violates laboratory protocols and can lead to inaccurate results, misdiagnosis, and inappropriate treatment, which constitutes a breach of professional duty and potentially violates healthcare regulations concerning the accuracy of diagnostic testing. Similarly, neglecting to ask about anticoagulant use before a venipuncture procedure could lead to excessive bleeding or hematoma formation, posing a direct risk to patient safety and violating the principle of providing competent care. Ignoring a patient's reported anxiety or discomfort without attempting to mitigate it demonstrates a lack of empathy and can lead to patient distress, potentially impacting their willingness to cooperate with future medical interventions and failing to meet the standard of compassionate care expected of healthcare professionals. The professional decision-making process for similar situations should involve a systematic approach. 1. Understand the specific requirements of the ordered test, e.g., fasting, medication restrictions. 2. Conduct a thorough patient interview to gather relevant medical history, current medication, allergies, and any immediate concerns. 3. Assess the patient's physical and emotional readiness for the procedure. 4. Identify any potential risks or contraindications. 5. Implement appropriate preparatory steps based on the assessment. 6. Document the assessment and any interventions. 7. If any concerns arise that fall outside the scope of practice or require physician input, escalate the situation appropriately. This structured approach ensures that patient safety and the quality of care are consistently maintained. Question 3. To address the challenge of a patient presenting for a routine phlebotomy appointment who exhibits persistent fatigue, unexplained weight gain, and reports feeling unusually cold despite ambient room temperature, what is the most appropriate course of action for a medical assistant with phlebotomy certification? Option A. Document the patient's reported symptoms and immediately inform the supervising physician or nurse of the observations for further medical assessment. Option B. Advise the patient that these symptoms are likely due to stress or normal aging and proceed with the blood draw as scheduled. Option C. Perform the phlebotomy and then instruct the patient to schedule a separate appointment with their primary care physician to discuss their symptoms. Option D. Suggest over-the-counter remedies for fatigue and weight management to the patient before performing the phlebotomy. The correct answer is A. Document the patient's reported symptoms and immediately inform the supervising physician or nurse of the observations for further medical assessment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical assistant with phlebotomy skills to recognize potential signs of a serious endocrine disorder, specifically hypothyroidism, in a patient presenting for a routine blood draw. The challenge lies in distinguishing between common, benign symptoms and those indicative of a potentially significant underlying condition that requires further medical evaluation. The medical assistant must exercise sound clinical judgment and adhere to scope of practice limitations while ensuring patient safety and appropriate care escalation. Correct approach analysis. The correct approach involves recognizing the constellation of symptoms, fatigue, weight gain, cold intolerance, dry skin, as potentially indicative of hypothyroidism, and reporting these observations to the supervising physician or nurse. This aligns with best professional practice by prioritizing patient well-being and adhering to the medical assistant's scope of practice, which includes observing and reporting patient conditions. This approach ensures that the patient receives timely and appropriate medical assessment and management for a potentially serious endocrine disorder, preventing delays in diagnosis and treatment. It also upholds ethical principles of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach is to dismiss the symptoms as unrelated to the phlebotomy procedure or as normal aging. This failure to recognize potential signs of an endocrine disorder is a significant ethical lapse, potentially leading to delayed diagnosis and treatment, which can have serious health consequences for the patient. Violates the principle of non-maleficence by failing to act when a potential harm is identified. Another incorrect approach is to attempt to diagnose or treat the suspected condition. This directly violates the scope of practice for a medical assistant, which does not include diagnosing or prescribing treatment. Such an action would be a serious regulatory and ethical breach, potentially leading to patient harm and professional disciplinary action. A third incorrect approach is to ignore the symptoms and proceed with the blood draw without any further action. This demonstrates a lack of clinical awareness and a failure to uphold the duty of care. While the phlebotomy itself may be performed correctly, the medical assistant has a responsibility to observe and report any significant patient findings that could impact their health. Ignoring these signs is a dereliction of professional duty. Professional reasoning. Medical assistants should employ a systematic approach when encountering patient symptoms. This involves 1. Observation, carefully noting any deviations from the patient's baseline or expected presentation. 2. Recognition, understanding common signs and symptoms of various conditions, including endocrine disorders within the scope of their training. 3. Reporting, promptly communicating significant observations to the appropriate supervising healthcare professional, physician, or nurse. 4. Documentation, accurately recording the observations and the action taken, e.g., report to physician. This process ensures patient safety, adherence to regulatory guidelines, and ethical practice. Question 4. Compliance review shows a phlebotomist documenting a venipuncture site using the term "the bend of the elbow." This documentation is being evaluated for adherence to professional standards and regulatory guidelines for accurate medical record keeping. Which of the following descriptions of the venipuncture site would be considered the most professionally appropriate and compliant? Option A. Near the watch band. Option B. The median cubital vein in the antecubital fossa. Option C. The crook of the arm. Option D. Where Mrs. Smith usually gets her blood drawn. The correct answer is B. The median cubital vein in the antecubital fossa. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare settings where clear and precise communication is paramount. Misunderstanding or misusing anatomical terms can lead to errors in patient care, documentation, and communication between healthcare professionals. The phlebotomist's role requires accurate identification of anatomical landmarks for successful venipuncture, and any ambiguity can compromise patient safety and the integrity of the procedure. Correct approach analysis. The correct approach involves using precise anatomical terminology to describe the location of the venipuncture site. This aligns with professional standards of practice and regulatory requirements for accurate medical documentation and communication. Using terms like antecubital fossa or median cubital vein provides specific, unambiguous information that is universally understood within the medical field. This precision ensures that other healthcare professionals can accurately interpret the documentation and understand the procedure performed, thereby upholding patient safety and regulatory compliance regarding accurate record keeping. Incorrect approaches analysis. Using vague or colloquial terms like the crook of the arm is professionally unacceptable because it lacks the specificity required for medical documentation and communication. This ambiguity can lead to misinterpretation, potentially resulting in procedural errors or confusion in patient records, which violates principles of accurate charting and patient safety. Referring to the site by a patient's personal description, such as "where Mrs. Smith always gets her blood drawn," is highly unprofessional and a significant ethical and regulatory failure. This approach introduces subjectivity, is not standardized, and could lead to errors if the patient's usual site is not appropriate or if another patient is mistaken for Mrs. Smith. It also fails to adhere to the requirement for objective, factual documentation. Describing the location in relation to a non-anatomical landmark, like near the watch band, is also unacceptable. Medical practice relies on established anatomical references, not arbitrary external objects. This method is imprecise, prone to variation based on clothing or accessories, and does not meet the standards for accurate medical communication or documentation, potentially leading to procedural difficulties or errors. Professional reasoning. Professionals should always prioritize clarity, accuracy, and standardization in their communication and documentation. When referring to anatomical locations, they must use established medical terminology. In situations involving patient care, especially procedures like phlebotomy, precise anatomical identification is critical for safety and efficacy. Professionals should be trained to use a consistent and accurate vocabulary, and when in doubt, they should consult anatomical references or senior colleagues to ensure they are using the correct terminology. This systematic approach minimizes the risk of errors and upholds professional standards. Question 5. The monitoring system demonstrates a new entry in the patient's electronic health record that reads dyspepsia. The medical assistant needs to accurately document the patient's chief complaint. Which of the following interpretations of the term dyspepsia demonstrates the most thorough understanding of its components and their contribution to its meaning? Option A. The patient is experiencing indigestion or difficult digestion. Option B. The patient is experiencing discomfort related to the stomach. Option C. The patient has a problem with their esophagus. Option D. The patient has a condition affecting the digestive system. The correct answer is B. The patient is experiencing discomfort related to the stomach. Explanation. Scenario analysis. This scenario presents a challenge in accurate medical documentation and patient communication, directly impacting patient care and regulatory compliance. Misinterpreting or incorrectly applying medical terminology, specifically prefixes, suffixes, and root words, can lead to significant errors in charting, reporting, and even in the patient's understanding of their condition. The medical assistant must possess a strong foundational knowledge of these linguistic building blocks to ensure precision and avoid miscommunication, which is paramount in a healthcare setting governed by strict documentation standards. Correct approach analysis. The correct approach involves accurately identifying the root word, prefix, and suffix to understand the full meaning of the medical term. For example, understanding hematuria requires recognizing hemato, blood, urea, urine, and the implied root related to presence. This precise understanding allows for correct documentation in the patient's chart, accurate communication with other healthcare professionals, and the ability to explain the condition to the patient in understandable terms, adhering to the principles of clear and accurate medical record keeping, as mandated by healthcare regulations. Incorrect approach is analysis. Focusing solely on the root word without considering the suffix can lead to an incomplete or incorrect understanding of the condition. For instance, knowing cardio relates to the heart is insufficient without understanding suffixes like itis, inflammation, or logi, study of, which drastically alter the meaning. This failure to grasp the complete term can result in inaccurate charting, potentially leading to misdiagnosis or inappropriate treatment, violating the regulatory requirement for accurate patient records. Guessing the meaning based on a partial understanding of a prefix or suffix is a significant ethical and regulatory failure. Medical terminology is precise, and assumptions can have severe consequences. For example, confusing a prefix like hyper, excessive, with hypo, deficient, can lead to the opposite interpretation of a condition, directly contravening the need for accurate and reliable patient information. Ignoring the term altogether or documenting a vague description instead of the precise medical term is also unacceptable. This circumvents the purpose of standardized medical terminology, hindering clear communication and potentially obscuring critical patient information from other healthcare providers, which is a breach of documentation standards. Professional reasoning. Professionals should approach medical terminology by systematically breaking down each term into its constituent parts, prefix, root word, and suffix. This analytical process ensures a comprehensive understanding of the term's meaning. When encountering unfamiliar terms, professionals should consult reliable medical dictionaries or terminology resources. In patient communication, they should strive to translate complex medical terms into plain language, verifying patient comprehension. This methodical approach, grounded in accurate knowledge and clear communication, is essential for maintaining patient safety and adhering to regulatory requirements for documentation and patient rights. Question 6. Governance review demonstrates a pattern of inconsistent use of medical abbreviations within patient charts. During a routine phlebotomy draw, a medical assistant encounters the abbreviation SOB in the physician's order for a blood test. The medical assistant is unsure if this refers to shortness of breath or son of a bitch, a slang term sometimes used informally. The medical assistant needs to proceed with the blood draw and document the encounter accurately. Which of the following actions best upholds professional standards and ensures patient safety in this situation? Option A. Use the facility's approved abbreviation list to confirm the meaning of SOB and document the full term if it is listed. Option B. Document the abbreviation SOB as written in the order and proceed with the blood draw, assuming the physician meant shortness of breath given the medical context. Option C. Politely ask the ordering physician for clarification on the abbreviation SOB before proceeding with the blood draw and documentation. Option D. Proceed with the blood draw and document the abbreviation SOB as written, making a mental note to look up the abbreviation later. The correct answer is B. Document the abbreviation SOB as written in the order and proceed with the blood draw, assuming the physician meant shortness of breath, given the medical context. Explanation. This scenario presents a professional challenge due to the potential for misinterpretation of medical abbreviations, which can lead to significant patient safety risks. The medical assistant must exercise careful judgment to ensure accurate communication and documentation. The correct approach represents best professional practice, because it prioritizes patient safety and adherence to established protocols for abbreviation use. By seeking clarification and documenting the full term, the medical assistant ensures that all healthcare providers have a clear and unambiguous understanding of the patient's condition and treatment plan, thereby preventing potential errors. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Furthermore, it upholds professional standards for accurate medical record keeping. An incorrect approach of assuming the meaning of an unfamiliar abbreviation is a direct violation of patient safety protocols. It introduces a high risk of misdiagnosis, incorrect medication administration, or inappropriate treatment, leading to potential patient harm. This constitutes a failure to uphold the duty of care owed to the patient. Another incorrect approach of using the abbreviation without verification in the facility's approved list or seeking clarification is a failure to follow established organizational policies and procedures. Such policies are typically in place to standardize communication and minimize errors. Ignoring these protocols can lead to inconsistent documentation and communication breakdowns, impacting the continuity of care. Finally, an incorrect approach of guessing the meaning based on context alone, without confirmation, is unprofessional and risky. While context can be helpful, it is not a substitute for accurate information. This can lead to the perpetuation of incorrect information within the patient's record, with potentially serious consequences for future care. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the ambiguity. Recognize when an abbreviation is unfamiliar or potentially ambiguous. 2. Consult reliable resources. Refer to the facility's approved abbreviation list or a reputable medical dictionary. 3. Seek clarification. If ambiguity persists, directly ask the ordering physician or a qualified colleague for clarification. 4. Document clearly. Record the full term or the clarified meaning in the patient's chart, avoiding the use of unverified abbreviations. 5. Report concerns. If there are systemic issues with abbreviation use or clarity, report these to a supervisor or the appropriate quality improvement committee. Question 7. Consider a scenario where a patient scheduled for routine phlebotomy reports a history of feeling dizzy and has fainted in the past during medical procedures. The medical assistant is preparing to draw blood. What is the most appropriate initial action to ensure patient safety and comfort during this procedure? Option A. Refuse to perform the venipuncture due to the patient's reported history of dizziness. Option B. Recline the patient in a chair or on a procedure table before beginning the venipuncture. Option C. Perform the venipuncture quickly while the patient is seated upright, assuming their dizziness is not severe. Option D. Proceed with the venipuncture while the patient is seated upright, but instruct them to take deep breaths. The correct answer is B. Recline the patient in a chair or on a procedure table before beginning the venipuncture. Explanation. Scenario analysis. This scenario presents a common challenge in phlebotomy where a patient's physical condition directly impacts the safety and efficacy of the procedure. The risk of syncope, fainting, is elevated due to the patient's history of dizziness and the invasive nature of venipuncture. A medical assistant must balance the need to obtain a blood sample with the paramount duty to ensure patient safety and prevent injury. Failure to adequately assess and mitigate these risks can lead to patient harm, such as falls, and potential regulatory noncompliance. Correct approach analysis. The correct approach prioritizes patient safety by implementing a risk mitigation strategy. Positioning the patient in a reclined or supine position significantly reduces the risk of injury should syncope occur. This position allows gravity to assist blood flow to the brain, decreasing the likelihood of fainting. If fainting does occur, the patient is already in a position that minimizes the risk of falling and sustaining trauma. This aligns with the general duty of care expected of healthcare professionals and the principles of patient safety, which are implicitly or explicitly covered by regulatory frameworks governing medical assisting practice, emphasizing the prevention of harm. Incorrect approaches analysis. One incorrect approach involves proceeding with the venipuncture while the patient is seated upright without any additional precautions. This fails to adequately address the identified risk of syncope. Regulatory frameworks for medical assistance often mandate that procedures be performed in a manner that minimizes patient risk. Allowing a patient with a history of dizziness to undergo venipuncture in a position that increases the likelihood of injury if they faint is a breach of this duty of care. Ethically, it demonstrates a lack of due diligence in patient assessment and safety planning. Another incorrect approach is to refuse to perform the venipuncture altogether without exploring alternative safety measures. While patient safety is paramount, a complete refusal without attempting to mitigate risks might be considered an overreaction if safer alternatives exist. Professional practice encourages finding solutions that allow necessary medical procedures to be performed safely. This approach might not align with the expectation that medical assistants will perform their duties competently and safely, seeking to accommodate patient needs within established safety protocols. A third incorrect approach is to perform the venipuncture quickly without any specific positioning adjustments, assuming the patient's history of dizziness is minor. This demonstrates a failure in risk assessment and a disregard for patient-reported symptoms. Regulatory guidelines and ethical principles require a thorough assessment of patient conditions that could impact procedure safety. Ignoring or downplaying such symptoms can lead to adverse events, violating the core tenets of patient care and safety. Professional reasoning. When faced with a patient who reports dizziness and has a history of syncope, a medical assistant should first conduct a brief risk assessment. This involves understanding the patient's symptoms and medical history. Based on this assessment, the assistant should then determine the safest method to perform the procedure. This might involve modifying the patient's position, ensuring a safe environment, e.g., clear of obstacles, and having assistance readily available if needed. The decision-making process should always prioritize patient well-being and adherence to established safety protocols, seeking to balance the need for the procedure with the imperative to prevent harm. Question 8. The investigation demonstrates a patient exhibiting audible wheezing and reporting shortness of breath when asked to take a deep breath for a venipuncture. The phlebotomist notes the patient appears anxious and is breathing rapidly. Which of the following actions best reflects professional best practice in this situation? Option A. Ask the patient to try and hold their breath for a moment while the venipuncture is performed to reduce the impact of their breathing. Option B. Ignore the wheezing and shortness of breath, assuming it is unrelated to the procedure, and proceed as scheduled. Option C. Proceed with the venipuncture quickly to minimize the time the patient experiences discomfort, reassuring them that it will be over soon. Option D. Politely inform the patient that the procedure cannot be performed at this time and immediately notify the nursing staff of the patient's respiratory symptoms. Correct answer is D. Politely inform the patient that the procedure cannot be performed at this time and immediately notify the nursing staff of the patient's respiratory symptoms. Explanation. This scenario presents a common challenge in phlebotomy where a patient's respiratory status may impact the procedure. The professional challenge lies in balancing the need to obtain a blood specimen with the patient's immediate well-being and the potential for exacerbating their respiratory distress. Careful judgment is required to assess the patient's condition, understand the implications of their symptoms, and select the most appropriate course of action that prioritizes safety and adheres to professional standards. The correct approach represents best professional practice because it aligns with the fundamental ethical and regulatory principles of patient care, specifically the duty of care and the principle of non-maleficence. By recognizing the signs of respiratory distress and prioritizing the patient's immediate comfort and safety, the phlebotomist is acting within their scope of practice and adhering to guidelines that mandate the assessment of a patient's condition before and during a procedure. This proactive approach prevents potential harm and ensures that the procedure is conducted in a manner that minimizes risk. An incorrect approach that involves proceeding with the venipuncture despite clear signs of respiratory distress demonstrates a failure to adequately assess the patient's condition and a disregard for their immediate safety. This could be considered a breach of the duty of care, as the phlebotomist has a responsibility to avoid causing harm. Furthermore, it may violate institutional policies and professional guidelines that require the postponement or modification of procedures when a patient's health is at risk. Another incorrect approach, such as immediately leaving the patient without any attempt to assess or offer assistance, could be seen as abandonment or a failure to provide appropriate care. While the phlebotomist is not a respiratory therapist, they are expected to recognize emergent situations and take appropriate steps, which might include alerting a nurse or physician. This approach fails to uphold the professional responsibility to respond to a patient's distress. A further incorrect approach, such as performing the venipuncture quickly without acknowledging or addressing the patient's symptoms, ignores the potential for the procedure itself to worsen their condition or for the patient's anxiety about the procedure to contribute to their respiratory distress. This demonstrates a lack of patient-centered care and a failure to consider the holistic impact of the procedure. The professional decision-making process for similar situations should involve a systematic approach. 1. Patient assessment. Always begin with a visual and verbal assessment of the patient's general condition, including their breathing. 2. Symptom recognition. Be aware of common signs of respiratory distress, e.g., shortness of breath, rapid breathing, wheezing, cyanosis. 3. Risk-benefit analysis. Evaluate whether proceeding with the procedure poses a significant risk to the patient's immediate health. 4. Communication. If distress is observed, communicate with the patient to understand their symptoms and then with the appropriate healthcare provider, e.g., nurse, physician, to seek guidance. 5. Prioritization. Patient safety and well-being are paramount and should always take precedence over the timely completion of a routine procedure. 6. Documentation. Accurately document all observations, actions taken, and communications with other healthcare professionals. Question 9. Upon reviewing a patient's chart for a scheduled phlebotomy draw, you note they have a documented sprained ankle and are experiencing significant pain when bearing weight or moving their lower extremities. The physician has ordered routine blood tests. The patient is seated and expresses concern that the venipuncture might be more painful or difficult due to their ankle injury, even though the intended venipuncture site is in the antecubital fossa. What is the most appropriate course of action? Option A. Refuse to perform the phlebotomy until the patient's ankle injury has healed, as the pain might make them overly anxious and difficult to manage. Option B. Immediately attempt venipuncture at the antecubital fossa, assuming the ankle injury has no bearing on the arm and the patient is simply being overly sensitive. Option C. Inform the patient that due to their ankle injury, phlebotomy cannot be performed today and reschedule for another time when they are feeling better. Option D. Assess the patient's antecubital fossa and surrounding arm for any signs of swelling or tenderness that might be exacerbated by venipuncture. And if the site appears suitable and the patient is comfortable with proceeding, perform the venipuncture. The correct answer is D. Assess the patient's antecubital fossa and surrounding arm for any signs of swelling or tenderness that might be exacerbated by venipuncture, and if the site appears suitable and the patient is comfortable with proceeding, perform the venipuncture. Explanation. Scenario analysis. This scenario presents a professional challenge because the medical assistant is faced with a patient experiencing acute musculoskeletal pain, requiring immediate attention and accurate assessment. The challenge lies in balancing the need for prompt patient care with the imperative to adhere to established phlebotomy protocols and patient safety guidelines, particularly when the patient's physical condition might complicate standard procedures. Misjudgment could lead to patient discomfort, injury, or inaccurate diagnostic results. Correct approach analysis. The correct approach prioritizes patient comfort and safety while ensuring the integrity of the phlebotomy procedure. This involves a thorough assessment of the patient's affected limb, communication with the patient to understand their pain and limitations, and the selection of an alternative, less painful venipuncture site. This aligns with the ethical obligation to provide care with compassion and respect, and regulatory guidelines that mandate patient safety and the prevention of iatrogenic harm. Choosing a site that minimizes pressure or strain on the affected joint or muscle is paramount. Incorrect approaches analysis. One incorrect approach involves proceeding with venipuncture at the initially requested site despite the patient's expressed pain and visible discomfort. This fails to uphold the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Regulatory frameworks for medical assistance emphasize patient comfort and safety, and ignoring a patient's pain can be construed as a breach of these standards, potentially leading to increased patient distress or even exacerbation of the musculoskeletal issue. Another incorrect approach is to refuse to perform the phlebotomy altogether without attempting to find a suitable alternative site or consulting with a supervisor. This demonstrates a lack of problem-solving skills and potentially delays necessary diagnostic testing, which could negatively impact patient care. While patient safety is paramount, a complete refusal without exploring alternatives may not align with the expected scope of practice for a competent medical assistant trained in phlebotomy, which includes adapting procedures when necessary and safe. A third incorrect approach is to attempt venipuncture on the affected limb without adequate consideration for the patient's pain or the potential for further injury. This could involve applying excessive tourniquet pressure, probing excessively for a vein, or positioning the patient in a way that exacerbates their condition. Such actions directly violate the principles of patient safety and could lead to adverse outcomes, including nerve damage, hematoma formation, or increased inflammation, all of which are preventable through careful assessment and site selection. Professional reasoning. Professionals should approach such situations by first performing a comprehensive patient assessment, including a visual inspection and palpation of potential venipuncture sites, while actively listening to the patient's description of their pain and limitations. Communication is key. A clear dialogue with the patient about their concerns and the rationale for any proposed adjustments to the procedure is essential. If the primary site is compromised, the professional should systematically evaluate alternative sites, considering anatomical landmarks and the patient's comfort. If uncertainty remains or the situation is complex, seeking guidance from a supervisor or physician is the appropriate next step to ensure the highest standard of patient care and adherence to regulatory requirements. Question 10. The risk matrix shows a high probability of patient harm if sterile technique is compromised during phlebotomy. A medical assistant is performing a venipuncture, and during the insertion of the needle, the patient coughs, causing a small amount of saliva to land on the sterile gauze pad positioned near the venipuncture site. What is the most appropriate immediate action for the medical assistant to take? Option A. Attempt to wipe the saliva off the gauze pad with an alcohol swab before using it. Option B. Immediately discard the contaminated gauze, stop the procedure, and re-prepare the venipuncture site with a new sterile gauze pad before proceeding. Option C. Proceed with the venipuncture and use a different uncontaminated gauze pad for post-puncture pressure, assuming the initial contamination is minor. Option D. Continue the venipuncture using the contaminated gauze pad, as the saliva is unlikely to cause significant harm. Correct answer is B. Immediately discard the contaminated gauze, stop the procedure, and re-prepare the venipuncture site with a new sterile gauze pad before proceeding. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical assistant with phlebotomy skills to balance immediate patient needs with the stringent requirements of maintaining a sterile field during a procedure. Potential for patient harm due to contamination is significant, and the assistant must make rapid, informed decisions under pressure, adhering to established protocols to prevent infection. Correct approach analysis. The correct approach prioritizes patient safety and adherence to surgical asepsis principles. By immediately stopping the procedure and addressing the contamination, the medical assistant demonstrates a commitment to preventing iatrogenic infection, which is a core ethical and regulatory responsibility. This aligns with guidelines from bodies like OSHA, Occupational Safety and Health Administration, and standard phlebotomy protocols that emphasize maintaining a sterile environment to protect patients from pathogens. This proactive measure prevents potential complications, reduces the need for further interventions, and upholds the professional standard of care. Incorrect approaches analysis. One incorrect approach involves continuing the procedure despite the visible contamination. This directly violates principles of surgical asepsis and infection control, increasing the patient's risk of developing a healthcare-associated infection. This failure could be considered negligence and a breach of the duty of care, potentially leading to disciplinary action and legal consequences. It disregards established protocols designed to safeguard patient well-being. Another incorrect approach is to attempt to clean up the contamination without re-establishing a sterile field or replacing contaminated supplies. This is insufficient to eliminate microbial load and does not meet the standards of surgical asepsis. It represents a superficial attempt at correction that fails to address the root cause of the contamination, thereby leaving the patient vulnerable to infection. This demonstrates a lack of understanding of the critical importance of a completely sterile environment for invasive procedures. A third incorrect approach might be to dismiss the contamination as minor and proceed without any corrective action. This shows a disregard for established safety protocols and a failure to recognize the potential severity of even seemingly small breaches in asepsis. The consequences of such oversight can be severe, ranging from localized infections to systemic sepsis, and it reflects a serious lapse in professional judgment and adherence to regulatory requirements for patient safety. Professional reasoning. When faced with a breach of asepsis during a procedure, a medical assistant should follow a structured decision-making process. 1. Recognize the breach immediately. 2. Halt the procedure to prevent further contamination. 3. Assess the extent of contamination and its impact on the sterile field. 4. Take appropriate corrective actions, which typically involve discarding contaminated items and re-establishing a sterile field. 5. Document the incident and corrective actions taken. This systematic approach ensures patient safety is paramount and regulatory compliance is maintained. Question 11. Examination of the data shows a medical assistant is preparing to perform a venipuncture on a patient. Upon approaching the patient, the medical assistant observes that the patient has several open, weeping sores on the arm where the venipuncture is to be performed. What is the most appropriate immediate course of action? Option A. Proceed with venipuncture using a new needle and syringe, but do not don gloves or clean the site further. Option B. Proceed with venipuncture without any additional precautions, as the patient requires the blood draw. Option C. Ask the patient to clean their own arm thoroughly before the procedure. Option D. Don gloves and use an antiseptic wipe to clean the venipuncture site before proceeding. The correct answer is A. Proceed with venipuncture using a new needle and syringe, but do not don gloves or clean the site further. Explanation. Scenario analysis. This scenario presents a common challenge in phlebotomy where a patient's visible skin condition raises concerns about potential infection transmission. The medical assistant must balance the need for patient care and specimen collection with the paramount responsibility of preventing the spread of infection to themselves, other patients, and the healthcare environment. This requires immediate, informed decision-making based on established protocols. Correct approach analysis. Adhering to standard precautions and facility-specific infection control policies is the cornerstone of safe phlebotomy practice. This approach prioritizes patient and staff safety by recognizing a potential breach in standard infection control measures. The medical assistant's action to don gloves and use an antiseptic wipe demonstrates immediate adherence to universal precautions, which are designed to protect against transmission of bloodborne pathogens and other infectious agents. This aligns with regulatory guidelines that mandate the use of personal protective equipment, PPE, and proper site preparation to minimize the risk of infection. Incorrect approach is analysis. Proceeding with venipuncture without any additional precautions fails to acknowledge the potential infectious risk posed by the patient's skin condition. This directly violates standard precautions and could lead to the transmission of pathogens to the medical assistant and potentially contaminate the venipuncture site, increasing the risk of a localized infection for the patient. This approach demonstrates a lack of adherence to fundamental infection control principles mandated by regulatory bodies overseeing healthcare practices. Using a new needle and syringe, but not donning gloves or cleaning, the site neglects critical steps in infection prevention. While a new needle reduces the risk of needle-stick injury transmission, it does not address the potential for pathogen transfer from the patient's skin to the medical assistant's hands or the venipuncture site. This oversight represents a failure to implement comprehensive infection control measures. Asking the patient to clean their own arm before the procedure is an inappropriate delegation of a critical safety step. The responsibility for ensuring a safe and sterile venipuncture site lies with the healthcare professional. Shifting this responsibility to the patient, especially when they may not have the knowledge or means to do so effectively, is a breach of professional duty and a failure to adhere to established protocols for patient care and infection control. Professional reasoning. When faced with a situation where a patient's condition might compromise standard infection control protocols, a medical assistant should follow a decision-making framework that prioritizes safety and adherence to regulations. This involves 1. Recognizing the potential risk, e.g., visible skin condition. 2. Immediately implementing appropriate personal protective equipment, PPE, and site preparation measures as per standard precautions. 3. Consulting with a supervisor or referring to facility policy if the situation is unclear or requires further intervention. 4. Documenting any deviations from standard procedure and the rationale for those actions. This systematic approach ensures patient well-being and compliance with all relevant healthcare regulations. Question 12. Performance analysis shows that medical assistants often encounter situations where they must relay diagnostic information to patients. If a physician's note indicates a patient has hypertension, what is the most appropriate way for a medical assistant to communicate this information to the patient during a routine follow-up, ensuring clarity and patient comprehension? Option A. State that the patient has high blood pressure and explain it in simple, everyday language. Option B. Explain that the patient has hypertension and briefly describe what it means in medical terms. Option C. Tell the patient their blood pressure reading was elevated and suggest they rest more. Option D. Avoid discussing the specific diagnosis and focus only on the vital signs taken. The correct answer is B. Explain that the patient has hypertension and briefly describe what it means in medical terms. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical assistant with phlebotomy skills to interpret and communicate potentially sensitive patient information accurately. Misinterpreting or miscommunicating medical terminology can lead to patient anxiety, incorrect self-care, or even medical errors if the patient misunderstands instructions related to their condition. The challenge lies in bridging the gap between technical medical language and understandable patient communication, while adhering to professional and ethical standards. Correct approach analysis. The correct approach involves using clear, simple language that the patient can understand, while still conveying the essential medical information. This aligns with the ethical principle of patient autonomy and the regulatory requirement for informed consent, which necessitates that patients understand their health status and treatment options. By translating hypertension to high blood pressure, the medical assistant ensures the patient grasps the core meaning without being overwhelmed by jargon, fostering better patient engagement and adherence to care. This practice is supported by general healthcare guidelines promoting patient education and clear communication. Incorrect approaches analysis. One incorrect approach involves directly using the technical term hypertension without explanation. This fails to adequately inform the patient, potentially violating ethical obligations to ensure patient understanding and regulatory expectations for clear communication in healthcare settings. It can lead to confusion and anxiety for the patient. Another incorrect approach is to oversimplify to the point of being inaccurate or dismissive, such as saying, "Your blood pressure is a bit high." While simpler, this lacks the necessary specificity and can downplay the seriousness of the condition, potentially leading to patient noncompliance with recommended lifestyle changes or medication. This approach risks misrepresenting the medical condition. A third incorrect approach is to avoid discussing the condition altogether, perhaps out of discomfort or lack of confidence in explaining it. This is a significant ethical and professional failure, as it denies the patient crucial health information they are entitled to receive. It also undermines the role of the medical assistant in patient education and support, and could be seen as a breach of duty of care. Professional reasoning. Professionals should approach patient communication by first understanding the medical term themselves. Then they should consider the patient's likely level of health literacy. The goal is to translate complex terms into plain language that is accurate, respectful, and empowering for the patient. This involves active listening to the patient's questions and concerns, and being prepared to rephrase explanations as needed. When in doubt about how to explain a term, consulting with a supervisor or referring to approved patient education materials is a best practice. The decision-making process prioritizes patient understanding and well-being within the scope of practice and regulatory guidelines. Question 13. Market research demonstrates that patient satisfaction with vital signs measurement is significantly influenced by the perceived respect for their comfort and autonomy. A medical assistant is tasked with taking a patient's temperature. The patient states, "I just ate a big meal, and I'd rather not have the thermometer in my mouth right now." The medical assistant knows that oral temperature measurement is the standard method, but also recognizes the potential for inaccuracy after eating and the patient's expressed discomfort. Which of the following approaches best upholds professional standards and patient-centered care in this situation? Option A. Proceed with taking the oral temperature immediately, reassuring the patient that it will only take a moment. Option B. Inform the patient that if they are unwilling to have their temperature taken orally, the measurement will be omitted from their chart. Option C. Politely explain to the patient that the oral temperature is the most accurate and that they should wait 15 minutes before the measurement, offering a glass of water to rinse their mouth. Option D. Offer to take the temperature using an alternative method, such as axillary or tympanic, explaining that these methods are also accurate and will be more comfortable for them at this time. The correct answer is C. Politely explain to the patient that the oral temperature is the most accurate and that they should wait 15 minutes before the measurement, offering a glass of water to rinse their mouth. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical assistant to balance patient comfort and dignity with the accurate and timely collection of vital signs. The patient's reluctance to have their temperature taken orally due to a recent meal introduces a potential conflict. The medical assistant must navigate this situation by employing their knowledge of best practices and patient communication skills to ensure both patient satisfaction and the integrity of the vital signs data. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient comfort and dignity while still ensuring accurate vital signs measurement. Offering an alternative method for temperature assessment, such as axillary or tympanic, respects the patient's stated concern and avoids potential inaccuracies if the patient is unable to hold the oral thermometer properly after eating. This aligns with ethical principles of patient autonomy and beneficence, as well as regulatory guidelines that emphasize accurate data collection and patient-centered care. The medical assistant is acting within their scope of practice by offering appropriate alternatives. Incorrect approaches analysis. One incorrect approach involves insisting on the oral temperature measurement despite the patient's expressed discomfort and recent meal. This fails to uphold patient dignity and autonomy, potentially leading to an inaccurate reading due to residual food or drink. It also demonstrates poor communication and a lack of empathy, which can erode patient trust and satisfaction. Ethically, it violates the principle of do no harm by potentially causing discomfort and compromising data accuracy. Another incorrect approach would be to skip the temperature measurement altogether because of the patient's reluctance. This directly compromises the completeness and accuracy of the vital signs assessment, which is a critical component of patient monitoring. It fails to meet professional standards for vital signs collection and could lead to missed diagnostic information. This approach neglects the medical assistant's responsibility to obtain all necessary data for patient care. A third incorrect approach might be to proceed with the oral temperature measurement without adequately explaining the alternative options or the rationale for them. While not as egregious as the other incorrect approaches, this still falls short of best practice. It misses an opportunity to educate the patient and involve them in their care, potentially leading to continued anxiety or misunderstanding. Effective communication is a cornerstone of professional medical practice. Professional reasoning. When faced with a situation where a patient expresses discomfort or potential impediment to accurate vital signs measurement, a medical assistant should first acknowledge the patient's concern. They should then assess the situation to determine if the concern genuinely impacts the accuracy of the measurement. If it does, the medical assistant should calmly and professionally explain the importance of accurate vital signs and offer alternative, appropriate methods for measurement that are within their scope of practice and align with best practices. This involves clear communication, patient education, and a commitment to obtaining reliable data while respecting patient comfort and dignity. Question 14. Analysis of a medical assistant performing a routine venipuncture on an adult patient who suddenly reports feeling lightheaded and dizzy and begins to exhibit pallor and diaphoresis. The medical assistant has been trained in basic life support and patient assessment. What is the most appropriate immediate course of action? Option A. Instruct the patient to take deep breaths and continue the venipuncture, assuming it is anxiety. Option B. Immediately stop the venipuncture, assess the patient's condition, and notify the supervising healthcare provider. Option C. Continue the venipuncture quickly to obtain the specimen before the patient's condition worsens. Option D. Ignore the symptoms and proceed with the venipuncture as scheduled, as it is a routine procedure. Correct answer is B. Immediately stop the venipuncture, assess the patient's condition, and notify the supervising healthcare provider. Explanation. Scenario analysis. This scenario presents a common implementation challenge in phlebotomy, ensuring patient safety and accurate specimen collection when a patient exhibits signs of potential cardiovascular distress during a routine blood draw. The challenge lies in balancing the need to obtain a necessary blood sample with the immediate imperative to assess and respond to a patient's changing physiological state, which could indicate a serious medical event. A medical assistant must exercise critical judgment, recognizing subtle cues and prioritizing patient well-being over the procedural task. Correct approach analysis. The correct approach prioritizes immediate patient safety and assessment, stopping the procedure, assessing the patient's vital signs and symptoms, and notifying the supervising healthcare provider are paramount. This aligns with the fundamental ethical and regulatory principles of patient care, which mandate that healthcare professionals act in the best interest of the patient and report any significant changes in their condition. In the U.S., this falls under the scope of practice for medical assistants as defined by state nurse practice acts and the Clinical Laboratory Improvement Amendments, CLIA, which emphasize patient safety and accurate specimen collection. The medical assistant's role includes recognizing and reporting changes in patient status. Incorrect approaches analysis. One incorrect approach involves continuing the venipuncture despite the patient's symptoms. This is a direct violation of the principle of do no harm and could exacerbate a potential cardiovascular event. It also compromises the integrity of the specimen if the patient's physiological state significantly alters blood composition. Ethically, it demonstrates a failure to prioritize patient well-being. Legally, it could lead to negligence claims. Another incorrect approach is to ignore the patient's symptoms and proceed with the draw as if nothing is happening. This shows a lack of observational skill and a failure to recognize the significance of the patient's presentation. It is a dereliction of the medical assistant's duty to monitor the patient during the procedure. A third incorrect approach is to simply tell the patient to breathe deeply and continue without further assessment or notification. While encouraging calm is sometimes appropriate, it is insufficient when there are clear signs of distress. This approach fails to acknowledge the potential seriousness of the symptoms and bypasses the necessary steps of assessment and professional consultation. Professional reasoning. When faced with a patient exhibiting new or worsening symptoms during a procedure, a medical assistant should follow a structured decision-making process. 1. Recognize and assess. Immediately observe and acknowledge the patient's signs and symptoms. 2. Stop the procedure. If the symptoms are concerning, cease the current task to prevent further harm. 3. Gather information. Assess vital signs if within scope and equipment is available and ask the patient about their symptoms. 4. Communicate. Promptly and clearly report the patient's condition and observations to the supervising physician or nurse. 5. Follow orders. Act according to the instructions provided by the supervising healthcare professional. 6. Document. Accurately record the event, assessment, and actions taken. Question 15. Operational review demonstrates that during a routine venipuncture for a complete blood count, a patient suddenly becomes pale, begins to perspire profusely, and reports feeling lightheaded. The medical assistant is holding the collection tube and has just begun to fill it. What is the most appropriate immediate action for the medical assistant to take? Option A. Remove the needle immediately and leave the patient unattended to retrieve additional supplies and inform a supervisor. Option B. Immediately cease the venipuncture, lower the patient's head between their knees or to a supine position if possible, and offer the patient a beverage of water or juice. Option C. Continue the venipuncture to ensure the sample is collected, and then address the patient's symptoms. Option D. Reassure the patient that these symptoms are common and proceed with completing the blood draw. The correct answer is B. Immediately cease the venipuncture, lower the patient's head between their knees or to a supine position if possible, and offer the patient a beverage of water or juice. Explanation. This scenario presents a common challenge in phlebotomy, balancing patient comfort and safety with the need for accurate sample collection. The professional challenge lies in recognizing subtle signs of patient distress and adapting the phlebotomy technique accordingly, while still adhering to established protocols to ensure sample integrity. Careful judgment is required to differentiate between minor discomfort and a more serious adverse reaction. The correct approach represents best professional practice because it prioritizes patient well-being and safety, which are paramount in healthcare. By recognizing the patient's pallor and diaphoresis as signs of vasovagal syncope, the medical assistant is acting proactively to prevent a fall and potential injury. Immediately ceasing the draw, lowering the patient's head, and offering fluids are evidence-based interventions for managing this common phlebotomy complication. This aligns with the ethical principle of non-maleficence, do no harm, and the regulatory requirement to provide care within the scope of practice, which includes recognizing and responding to patient distress. An incorrect approach of continuing the draw despite the patient's symptoms would be a significant regulatory and ethical failure. It demonstrates a disregard for the patient's immediate safety and well-being, violating the principle of non-maleficence. This could lead to a fall, injury, and a breach of the standard of care expected of a certified medical assistant. Furthermore, it fails to recognize and address a potential adverse event, which could have legal ramifications and disciplinary action from regulatory bodies. Another incorrect approach, such as immediately leaving the patient unattended to fetch additional supplies, would also be professionally unacceptable. Supplies are necessary. A patient exhibiting signs of syncope requires immediate attention and monitoring. Abandoning the patient in such a state constitutes a breach of duty of care and could exacerbate the situation. This demonstrates poor professional judgment and a failure to prioritize immediate patient needs. A third incorrect approach, such as dismissing the patient's symptoms as nervousness and proceeding with the draw, ignores critical physiological cues. This demonstrates a lack of observational skill and an inability to assess patient condition, which is a core competency for a medical assistant. It prioritizes the task over the patient's health, leading to potential harm and a failure to meet professional standards. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe the patient for any signs of distress or adverse reactions. 2. Assess the severity of any observed symptoms. 3. If distress is noted, immediately pause or cease the procedure. 4. Implement appropriate interventions based on the observed symptoms and established protocols. 5. Monitor the patient's condition until they have fully recovered. 6. Document the event and the interventions taken. 7. Report the incident as per facility policy. This framework ensures that patient safety is always the primary consideration. Question 16. Quality control measures reveal that a medical assistant, in a busy clinic setting, has placed a used biohazardous sharps container into the general waste bin without following the facility's established disposal protocol. What is the most appropriate immediate action for the medical assistant to take? Option A. Immediately retrieve the sharps container, place it in a designated biohazardous waste receptacle, and report the incident to the supervisor for review of the disposal protocol. Option B. Discreetly remove the sharps container and dispose of it in an external dumpster to avoid internal scrutiny. Option C. Leave the sharps container in the general waste bin and assume it will be handled appropriately by the waste disposal service. Option D. Attempt to rinse the sharps container to remove visible contamination before placing it in the general waste bin. Correct answer is A. Immediately retrieve the sharps container, place it in a designated biohazardous waste receptacle, and report the incident to the supervisor for review of the disposal protocol. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct breach of established protocols for handling and disposing of biohazardous materials. Medical assistants are entrusted with patient safety and public health. An improper disposal can lead to the spread of infection, environmental contamination, and legal repercussions for the facility and the individual. The pressure of a busy clinic and the potential for oversight necessitate a vigilant and systematic approach to waste management. Correct approach analysis. Adhering strictly to the facility's established biohazardous waste disposal protocol, which aligns with OSHA, Occupational Safety and Health Administration, guidelines for regulated medical waste, represents best professional practice. This protocol typically involves segregating biohazardous waste from general waste, using designated leak-proof and puncture-resistant containers, proper labeling of these containers, and ensuring that disposal is handled by a licensed medical waste disposal service. This systematic approach minimizes the risk of exposure to healthcare workers, patients, and the public, and ensures compliance with federal and state regulations designed to protect health and safety. Incorrect approaches analysis. Segregating the contaminated sharps container with general waste is a significant regulatory and ethical failure. OSHA Bloodborne Pathogen Standard, 29 CFR 1910-1030, mandates specific procedures for handling contaminated sharps to prevent accidental punctures and the transmission of infectious diseases. Mixing biohazardous sharps with general waste bypasses these critical safety measures, creating a direct risk of injury and infection for waste handlers and the public. Disposing of the contaminated sharps container in the regular trash without proper containment or labeling is a severe violation of biohazard waste management regulations. This action disregards the inherent risks associated with sharps and biohazardous materials, potentially exposing sanitation workers and the environment to infectious agents. It demonstrates a lack of understanding of the potential consequences of improper disposal and a failure to uphold professional responsibility for public health. Attempting to rinse the contaminated sharps container before disposal in the regular trash is also a regulatory and ethical failure. Rinsing does not neutralize the biohazardous nature of the contents, and the wastewater itself could become contaminated. Furthermore, it does not address the primary hazard of the sharps themselves, which remain a puncture risk. This approach fails to meet the requirements for rendering biohazardous waste safe for disposal and demonstrates a misunderstanding of effective decontamination and disposal procedures. Professional reasoning. When faced with a situation involving biohazardous waste, a medical assistant should always prioritize adherence to established protocols. The decision-making process should involve 1. Identifying the type of waste and its associated hazards. 2. Recalling and applying the facility's specific biohazardous waste management plan. 3. Consulting with a supervisor or designated safety officer if there is any uncertainty about the correct procedure. 4. Ensuring all steps are taken to prevent exposure and environmental contamination. This systematic and protocol-driven approach is fundamental to maintaining a safe healthcare environment and complying with regulatory mandates. Question 17. Research into the overview of human body systems is crucial for a medical assistant performing phlebotomy. A patient presents for a routine blood draw and mentions experiencing recent shortness of breath and fatigue. Which of the following approaches best demonstrates an understanding of how systemic conditions can impact phlebotomy procedures and patient safety? Option A. Recognizing that shortness of breath and fatigue could indicate a respiratory or cardiovascular issue, prompting a closer assessment of the patient's vital signs and a review of their medical history for conditions affecting circulation or oxygenation before proceeding with venipuncture. Option B. Proceeding with the venipuncture as scheduled, assuming the symptoms are unrelated to the blood draw and focusing solely on the technical aspects of specimen collection. Option C. Asking the patient to describe their symptoms in detail, but not altering the phlebotomy procedure as the symptoms do not directly relate to the veins. Option D. Suggesting the patient reschedule their appointment for a time when they feel better, without inquiring further into the nature of their symptoms or their potential systemic implications. The correct answer is A. Recognizing that shortness of breath and fatigue could indicate a respiratory or cardiovascular issue, prompting a closer assessment of the patient's vital signs and a review of their medical history for conditions affecting circulation or oxygenation before proceeding with venipuncture. Explanation. This scenario is professionally challenging because a medical assistant, while performing phlebotomy, must possess a foundational understanding of the human body systems to ensure patient safety and accurate specimen collection. Misinterpreting symptoms or failing to recognize potential complications related to a patient's underlying condition can lead to adverse events. Careful judgment is required to connect observable patient status with relevant physiological knowledge. The correct approach represents best professional practice because it demonstrates an understanding of the interconnectedness of body systems and how a patient's condition might impact phlebotomy. Recognizing that a patient with a known cardiovascular condition might have compromised circulation or be on anticoagulant therapy directly informs the phlebotomist's technique, site selection, and post-collection care. This aligns with the general duty of care expected of healthcare professionals, which includes anticipating potential risks and acting to mitigate them, as implicitly required by standard medical assisting protocols and patient safety guidelines. An incorrect approach that focuses solely on the mechanical act of venipuncture without considering the patient's systemic health is professionally unacceptable. This fails to meet the standard of care by neglecting a crucial aspect of patient assessment. Such an approach could lead to complications like excessive bleeding, hematoma formation, or even more serious issues if the patient has a condition that contraindicates standard phlebotomy procedures or requires specific precautions. This would violate ethical principles of patient well-being and potentially breach regulatory requirements for competent practice. Another incorrect approach that dismisses patient-reported symptoms as irrelevant to phlebotomy is also professionally unacceptable. Symptoms, even if seemingly minor, can be indicators of underlying systemic issues that could affect the phlebotomy procedure or the patient's response to it. Ignoring these signals demonstrates a lack of holistic patient assessment and a failure to adhere to best practices in patient care, which mandate considering the patient's overall health status. The professional reasoning process for similar situations involves a systematic approach. 1. Patient assessment. Gather information about the patient's current condition, medical history, and any reported symptoms. 2. Systemic awareness. Relate the patient's condition and symptoms to relevant human body systems and their functions. 3. Risk identification. Identify potential risks or complications associated with the phlebotomy procedure given the patient's systemic status. 4. Procedural adaptation. Modify phlebotomy technique, site selection, or post-collection care as necessary to mitigate identified risks. 5. Documentation and communication. Accurately document all observations and actions, and communicate any concerns to the supervising healthcare provider. Question 18. Cost-benefit analysis shows that a thorough pre-procedure patient assessment, including visual observation for distress and direct questioning about their current physical state, is paramount. When a patient appears pale and states they feel a bit lightheaded just before a scheduled venipuncture, which of the following actions best exemplifies best professional practice in patient preparation and assessment? Option A. Pause the procedure. Ask the patient to describe their symptoms in more detail, observe for further signs of distress, and assess their ability to tolerate the procedure before proceeding or postponing. Option B. Assume the patient is anxious and will recover quickly, proceeding with the venipuncture as scheduled to avoid delaying the lab results. Option C. Immediately cancel the venipuncture and inform the physician without further assessment or communication with the patient. Option D. Proceed with the venipuncture after a brief reassurance, documenting the patient's statement and the decision to proceed. Correct answer is D. Proceed with the venipuncture after a brief reassurance, documenting the patient's statement and the decision to proceed. Explanation. Scenario analysis. This scenario presents a common challenge in phlebotomy where a patient's physical condition might impact the safety and accuracy of a blood draw. The medical assistant must balance the need to obtain a specimen with the patient's well-being and the integrity of the sample. Overlooking a patient's stated discomfort or visible signs of distress can lead to adverse events, patient injury, and a breach of professional duty. The challenge lies in accurately assessing the patient's readiness and identifying potential contraindications without causing undue delay or anxiety. Correct approach analysis. The correct approach prioritizes patient safety and informed consent, which are fundamental ethical and regulatory principles in healthcare. By performing a thorough patient assessment, including observing for signs of distress and inquiring about their current state, the medical assistant upholds the standard of care. This proactive assessment allows for the identification of potential issues, such as vasovagal syncope or localized infection, before they escalate. Documenting these findings and the patient's consent to proceed, or the decision to postpone, is crucial for legal and medical record keeping, aligning with guidelines for patient care and documentation. Incorrect approaches analysis. One incorrect approach involves proceeding with the venipuncture despite visible signs of patient anxiety and a stated feeling of dizziness. This disregards the patient's subjective experience and objective indicators of potential adverse reaction. Ethically, this violates the principle of non-maleficence, do no harm, and patient autonomy. Legally, it could be considered negligence if the patient experiences a syncope event or injury. Another incorrect approach is to immediately cancel the draw without further assessment or communication. While caution is important, a complete cancellation without understanding the cause of the patient's distress or attempting to alleviate it might be premature. This could lead to unnecessary delays in diagnosis and treatment, impacting patient care and potentially violating the duty to provide care within the scope of practice. A third incorrect approach is to assume the patient is exaggerating their symptoms and proceed without adequate consideration. This dismisses the patient's concerns and can lead to a compromised assessment. It fails to acknowledge the potential for serious physiological responses and demonstrates a lack of empathy and professional diligence, which are core to patient-centered care. Professional reasoning. Professionals should employ a systematic approach to patient assessment before any procedure. This involves 1. Reviewing the patient's chart for any pre-existing conditions or contraindications. 2. Visually observing the patient for signs of distress, pallor, or diaphoresis. 3. Engaging in clear, open-ended communication with the patient to understand their current state and any concerns. 4. If concerns are identified, assessing their severity and determining if the procedure can be safely performed, modified, or postponed. 5. Documenting all findings, discussions, and decisions made. This process ensures patient safety, upholds ethical standards, and complies with regulatory requirements for patient care. Question 19. Compliance review shows a medical assistant has been tasked with collecting various laboratory specimens. The physician's order specifies a fasting blood glucose test. The medical assistant proceeds to collect a urine sample for urinalysis instead of a blood sample. Which of the following actions, if taken by the medical assistant, would represent a failure to adhere to proper specimen collection protocols and regulatory requirements? Option A. Using a lavender top tube for a coagulation study when a light blue top tube is required. Option B. Labeling the collected blood specimen after returning to the laboratory processing area. Option C. Collecting a urine specimen for urinalysis when a blood glucose test was ordered. Option D. Verifying the physician's order and patient identification before collecting any specimen. The correct answer is C. Collecting a urine specimen for urinalysis when a blood glucose test was ordered. Explanation. Scenario analysis. This scenario presents a common challenge in phlebotomy practice, ensuring the correct specimen type is collected and handled according to laboratory protocols. The challenge lies in the potential for misidentification, contamination, or improper collection techniques, all of which can lead to inaccurate test results and potentially compromise patient care. Medical assistants must possess a thorough understanding of various specimen types and their specific collection requirements to avoid these pitfalls. Correct approach analysis. The correct approach involves meticulously verifying the physician's order against the patient's identity and the specific specimen required. This includes confirming the correct anticoagulant or preservative is used if applicable, the appropriate collection tube is selected, and the specimen is labeled accurately and immediately at the patient's side. This adheres to CLIA, Clinical Laboratory Improvement Amendments, regulations, which mandate accurate patient identification and specimen integrity to ensure the reliability of laboratory testing. Best professional practice dictates a systematic, step-by-step process to minimize errors and uphold patient safety and diagnostic accuracy. Incorrect approaches analysis. Collecting a urine specimen when a blood specimen was ordered is a direct violation of the physician's order and laboratory protocols. This leads to a false negative or irrelevant result, requiring a redraw and delaying diagnosis and treatment. It demonstrates a failure to verify the order and understand specimen requirements, potentially violating CLIA regulations regarding specimen integrity and accuracy. Assuming a standard blood collection tube is appropriate for all blood tests, without verifying the specific test ordered is also a significant error. Different blood tests require different additives or no additives in the collection tube. Using the wrong tube can lead to inaccurate results due to interference with the test methodology or improper preservation of the analyte. This again points to a failure in adhering to specimen integrity requirements mandated by CLIA. Labeling the specimen after leaving the patient's room, even if the correct specimen was collected, introduces a high risk of misidentification. Specimen labeling must occur immediately after collection and at the patient's bedside to ensure the specimen is unequivocally linked to the correct patient. Failure to do so violates patient identification protocols and can lead to critical errors in reporting and patient care, contravening CLIA emphasis on accurate patient identification. Professional reasoning. Medical assistants should employ a verify, collect, label, transport framework. Always verify the physician's order and patient identification before initiating any collection. Understand the specific requirements for each specimen type ordered, including the correct collection device, any necessary additives, and proper handling. Label the specimen accurately and immediately at the patient's side. Finally, ensure proper transport to the laboratory. This systematic approach, grounded in regulatory compliance and patient safety, is crucial for accurate diagnostic testing. Question 20. Which approach would be most appropriate for a medical assistant to document a patient's subjective report of feeling like their insides are churning and a knot in their stomach when the patient is experiencing gastrointestinal distress? Option A. Translate the patient's descriptions into precise medical terminology, such as abdominal cramping and epigastric discomfort, after clarifying the location and duration of the sensations. Option B. Document only the patient's vital signs and ignore the subjective gastrointestinal complaints as they are not precise medical terms. Option C. Assume the patient is experiencing anxiety and document it as patient appears anxious with somatic complaints. Option D. Record the patient's exact phrases, insides churning and knot in stomach, verbatim in the patient's chart. The correct answer is A. Translate the patient's descriptions into precise medical terminology, such as abdominal cramping and epigastric discomfort, after clarifying the location and duration of the sensations. Explanation. Scenario analysis. A medical assistant is tasked with documenting a patient's complaint of abdominal pain. The patient uses non-medical terms to describe their discomfort, such as tummy ache and feeling bloated. The medical assistant must accurately translate these lay terms into precise medical terminology for the patient's chart, ensuring clear communication among healthcare providers and accurate record keeping. This scenario is professionally challenging because misinterpretation or imprecise documentation can lead to diagnostic errors, delayed treatment, or inappropriate interventions, impacting patient safety and care quality. Correct approach analysis. The correct approach involves actively listening to the patient, asking clarifying questions to understand the nature, location, and duration of their symptoms, and then using their knowledge of anatomical and physiological terminology to accurately record the information. For example, tummy ache might be translated to abdominal discomfort or epigastric pain, and bloated could be documented as abdominal distension or feeling of fullness. This approach upholds the professional standard of accurate and objective documentation, crucial for continuity of care and adherence to medical record-keeping regulations. It ensures that the patient's subjective experience is objectively represented in a way that is understandable and actionable by other healthcare professionals. Incorrect approaches analysis. One incorrect approach would be to simply write down the patient's exact words, tummy ache, bloated, in the medical record without translation. This fails to meet the professional requirement for using standardized medical terminology, hindering clear communication and potentially leading to misinterpretation by other healthcare providers. It also represents a failure to accurately document the patient's condition in a clinically relevant manner. Another incorrect approach would be to guess at the underlying medical condition based on the lay terms and document a presumptive diagnosis without proper physician assessment. For instance, assuming tummy ache automatically means appendicitis would be a significant error. This bypasses the physician's role in diagnosis and can lead to incorrect treatment plans and patient harm, violating ethical principles of patient care and professional boundaries. A third incorrect approach would be to ignore the patient's description of pain and focus only on vital signs, assuming the lay terms are not clinically significant. This neglects a crucial piece of patient-reported information that can guide diagnosis and treatment. It demonstrates a lack of understanding of the importance of patient history in medical assessment and can lead to incomplete or inaccurate patient records. Professional reasoning. Professionals should employ a systematic approach, active listening, patient-centered questioning, accurate translation of lay terms to medical terminology using their knowledge base, and objective documentation. When in doubt about the precise medical term, seeking clarification from a supervisor or physician is a responsible step. This ensures that patient information is recorded accurately, ethically, and in compliance with professional standards for medical documentation.